Hello, lab experts. Welcome to the Diagnostics podcast, the podcast where we discuss everything medical laboratory science in Africa and around the world. In today's episode, we sit down with Linda, Oskam, and Tjeerd Datema, laboratory advisors that have had the opportunity to work worldwide with governments, medical laboratories, and NGOs in the area of laboratory strengthening. We're going to talk a little bit about that experience, what they have learned working in Asia, Africa, Latin America, and other places, and they'll give us their perspective on how laboratories need to move. Hello, Tjeerd. Hello, Linda. Welcome to the Diagnostics podcast. How are you doing today?
I think we're both doing very well.
Absolutely. Yeah.
End of the week, nearly weekend, always nice.
Oh, yeah, true. Weekend is always nice. Well, we'll start by talking a little bit about laboratory network strengthening. One question I had for those who might be interested but who don't necessarily know what laboratory network strengthening is, what is it exactly?
Okay, what is laboratory network strengthening? Well, no laboratory can work on its own, can do everything on its own. So the idea is that laboratories function in networks with tiers. So you have very simple laboratories, and then let's say community health laboratories. Then you have the district laboratories, maybe the provincial laboratories, and then you have the national laboratories. And the complexity and a number of tests that can be performed, different types of tests, actually increases as you go up in the pyramid. And by working together, you can actually make sure that every test in the country can be done at the appropriate level. And it's important to have a network because most tests, complex tests, can be done at the top, but most patients are actually seen at the bottom. Most patients come in at the community health centers. And if they have more complex diagnostic needs, then you actually need to have a system that makes sure that you can move your sample up in the pyramid. So you need also a sample referral system and a data referral system, the samples going up and the data going down in the network. And there are many other advantages to having a proper network in the country, which we can discuss.
That actually sounds a bit hard to manage, though. Samples going up, data going down. How are those systems arranged to be able to manage that? Especially, say, in countries where there may be problems with electricity or there may be problems with data, or even in some cases, transport.
Yeah, I think the transport is where it really starts. I mean, the first thing you need to do is to design a system. And there are many like normal things, like people use cars or people use motorbikes, for example, Riders for Health, which you have in many African countries. But nowadays, it's also possible, for example, to involve the postal services, as long as the people who transport it get specific training for transporting infectious samples. Then you can also use postal services, for example. But there are also very innovative new initiatives, like in Malawi, they are using drones. And I seem to remember Burkina Faso was also working with drones, but I'm not completely sure about that. But I'm sure about Malawi that they use drones. So there are many different ways in which you can do that. And regarding a data transfer, I mean, I agree that it might be a challenge, but we also see that in Africa, especially in Africa, the connectivity is getting better very, very rapidly. Not only through internet, but especially mobile phones, of course. I mean, and there are many ways in which you can develop apps, for example, for mobile phones, also for data exchange. Of course, it's a bit a question of privacy and data protection, but it is possible to communicate very quickly with each other nowadays.
So would you say that laboratory strengthening is particularly important for, let's say, specialization to help with...
Like a specific disease, you mean, or?
Not necessarily specific disease, but like you said, what's happening is at some levels, you may have samples being moved, let's say, to another laboratory, maybe because the laboratory is better suited in order to carry out the testing.
Yeah,
or what's
I think
the...
Go ahead.
Yeah,
Yeah, go ahead.
it depends really on so all these things that we talk about, all the different aspects of laboratory network strengthening, start by looking at the situation in the country. Well, if you talk about sample referral, what is a landscape and everything, but also indeed which type of testing is performed at which laboratory, at which level or tier of the laboratory network. So yeah, if you talk about setting up sample referral system, you need to look at which laboratory does which test and what is the most logical sample referral algorithm that you can follow.
Yeah, but I think there's more to a network actually. You can also use it, for example, for setting up a good supply chain system, or for external quality assessments, where actually the higher tier laboratories help the lower tier laboratories. For example, with ordering of and getting materials, or with support and training and things like that. So a network actually ensures that all laboratories can gain advantage from improvements, and not only the laboratories at the top, which gets often all the international training and things like that.
It's quite a versatile topic. It's laboratory network strengthening involves a lot of different types of activities, different aspects of the interactions between different laboratories in the country.
Yeah, so it's not only specialization, but it's also generalization in a sense. Yeah. So it works both ways.
True. Yeah, actually has to go both ways. Yes. Now, assuming there's someone who's watching this, say, from a government somewhere in Africa or Asia or another continent, that's thinking that there might be a need for reinforcements in this area. So what you're essentially saying is, depending on the country, where the work starts might actually differ. It's not necessarily always going to start from the same point, but an assessment essentially has to be done first.
Well, I think the first step, if you want to strengthen the laboratory network or laboratory system in a country, is actually indeed looking at what's there. And there are different tools around. Very good one is the LabNet scorecard. This is an assessment tool that was developed specifically to assess laboratory networks and assess all the different functions of a laboratory network, and the outcome you get is a very nice overview of what are the strengths and weaknesses of the laboratory network in a specific country. Mm-hmm. And this is a very good basis to start formulating or identifying interventions for improving those aspects of the laboratory network that are most urgent.
And it actually already contains some guidance on what you should improve in order to go to the next stage. Yeah. And actually the LabNet scorecard was developed and is owned by African Society of Laboratory Medicine.
Yeah.
So really? It's also a very, I mean, the African Society of Laboratory Medicine is really a very good source for anybody in Africa working in laboratory sciences. Yeah. All the way from publications to tools to training, everything.
Yeah, aside from this LabNet scorecard, they have also different other tools. That they have the lab map where they map the laboratory network geographically, but also the diagnostic network optimization tool. So they have the whole library of tools that can assist countries with strengthening laboratory networks and systems, specifically in Africa.
And actually ASLM, actually in 2 weeks' time I'll be in Zimbabwe. We're going to roll out for ASLM, or actually ASLM is going to roll out, I have to say, the LabNet Lead course, which is a course for the leaders of the laboratory services to also help them improve the network, and to also give them the essential management skills to be able to lead that process.
She's getting dark rapidly on your side again.
Exactly. The problems we have in Africa, electricity.
Yeah.
Usually it's when you need it the most that it disappears.
Yeah, exactly.
But yeah, so are there some lab networks that you've been particularly inspired by over the years that you've, let's say, toured different continents?
Yeah, actually, Well, for me, it's quite a long time ago. It's about 10 years ago. It's actually in Benin, the TB laboratory network that we had to assess in 2010. It's even 12 years ago already. Yeah. For me, this was one of the first lab network assessments that I did actually in my career. But I must say that this was really a strong network where they really made use of the opportunities that a network offers to assist laboratories improve their performance. So, they had this supervision system where, as Linda said, the laboratories in higher tiers of the network assisted laboratories in lower tiers. So the National TB Reference Laboratory assisted the district laboratories. District laboratories supported the health center laboratories. They had their resource distribution as centralized, if I remember well. The NTRL was responsible for making sure that all these laboratories had all the reagents necessary to conduct the TB testing. EQA, the NTRL also circulated EQA panels, if I remember correctly. They did the rechecking. The rechecking. Yeah. So they went. The staff from the NTRL went into the country every 3 or 4 months, if I remember correctly, to provide support, supervision, and rechecking of samples at district laboratories, and those laboratories did it to the health center labs in the country. So and it really worked nicely. Actually, it was really a good system.
Yeah.
What would of course be nice is I mean, this is a vertical program, of course, focusing on tuberculosis, but yeah, what would be nice is, of course, to if it would be possible to expand those strengths of that network to a more general laboratory network, a public laboratory network, in a sense.
Yeah. And of course, Benin has the advantage that it's a relatively small country, and that it's also geographically, it's not too difficult. It's not like there are enormous mountain ranges in between the north and the south or anything. So that actually made it relatively simple. I think we were talking about 64 at that time, TB laboratories, if I remember correctly.
Yeah.
So that is manageable. I mean, if you do the same in Nigeria, it's a bit different.
More complex, yeah. And I think right now in Benin, it might also, things are also slightly easier these days because the roads are also a lot better, probably, than what you saw when you came back then. Actually, I was going through the website and I remember seeing the picture of the tuberculosis national lab on one of the pictures down there.
Yeah, that's true. Yeah.
What other African countries? Yeah, what other African countries have you worked in?
How many would you want to hear?
Which ones not?
Yeah. We worked in South Africa, Mozambique, Botswana. I'm going to Zimbabwe shortly. I'm going from south to north, Malawi, Zambia, Mozambique. I'm not sure what I mentioned. Tanzania, Kenya, Ethiopia, Sudan, Uganda, Rwanda, Cameroon, Nigeria, Benin, Sierra Leone, Mali,
Liberia, Egypt.
Liberia, Egypt, quite a few.
Sure.
You have seen a lot more African countries than I have.
Comes with the job,
Yeah, and so I guess in most cases, when you're doing that, it's mostly with the help of national governments, like you're working in cooperation with national governments for the most part.
Well, it actually varies.
Okay.
So, I mean, our activities are really from assisting national governments, indeed, with national laboratory policies and strategic plan development, conducting complete laboratory network and system assessments, but also assisting individual laboratories with the implementation of a quality management system, improving their biosafety, and basically everything in between.
Yeah, training groups of people, and sometimes they are from the whole country or from multiple countries, but sometimes they are only from 1 or 2 institutes. So
that really depends on the assignment, indeed. Yeah.
So when we take medical laboratory science, I don't know about all the countries, but I know in some countries, say in Nigeria, Benin, Ghana, Togo. I've spoken with some scientists who, in some cases, how will I put that? Say that they would like their system to be a lot more integrated, but they're not necessarily sure about how to go about it to ensure that that happens. Like, if there are people in that situation that are watching this, what would you say would be some steps that they could take even at their lower levels to try and ensure that that happens?
I think it always starts at the top, actually. I mean, the Ministry of Health is often the driver of these kind of processes. Also, because you need to have some kind of regulatory system in place and everything. So if you don't have a good policy and a good strategic plan, then it's very difficult for individual laboratories to start changing the whole system. You really have to work together for this. And ideally, even with under the One Health concept, so that you also include the veterinary and the agriculture and the food safety and the environment laboratories, if they are there in the country. So individual laboratories at lower levels, I think that's difficult.
Yeah, what I'm just on the top of my mind, I would say what they can do is try to form collaborations, as in or form a group in advocacy groups to try to convince the government to initiate more national planning and on these topics.
Yeah, that's actually an activity which I'm currently performing with Amabiot, the Association of Balinese Biotechnologists, for actually making, which is a professional organization of laboratory staff, Mali-wide. And they are actually making a strategic plan where they're going to decide what are we going to do in the next 3 to 5 years. And that is a very good way to organize yourself as laboratory workers. And then if you make a strategic plan, to get your act together and to professionalize your organization and professionalize the job, the laboratory workers' job in essence, and make sure that you have better leverage with the governments to improve the situation of the laboratories.
Yeah. Okay, so one quick last question. According to you, what does the future of laboratory strengthening look like in some of the countries you've worked in?
Well, I think, it's difficult to say for a specific country, but what we see happening, and that's also, of course, partly caused by the COVID-19 pandemic, is that it becomes much clearer that only strengthening of laboratory facilities is only just a part of the job. It becomes much more important, or it is much more important, to focus on strengthening complete laboratory networks and systems in the country, as we talked about. Especially, it makes a lot of things possible. The sharing of resources, the centralized distribution. So I think the focus now shifts more to laboratory systems and network strengthening. And one example is a guidance document that was launched last year in November by Africa CDC and ASLM, the African Society for Laboratory Medicine. They launched a guidance for establishing a national laboratory quality framework, which is really the next step in advancing quality management system implementation by laboratories in Africa. Up to over the past 10, 15 years, tools like the SLAMTA and SLIPTA, these are lab strengthening tools that assist laboratories with implementation of a quality management system. They assist individual laboratories. These are tools that individual laboratories can use, and they work well. But what you see is that those laboratories that use those tools are able to implement the quality management system, but it's very difficult for them to maintain it or to continuously improve it without support from a laboratory system and a laboratory network. For example, they can't maintain their equipment because the equipment maintenance capacity in a country is not there or is very limited. And that is, of course, one of the elements that's needed for sustaining a quality management system. And now the next step that Africa CDC and ASLM are taking is to really take a country-wide approach, also again through the government, to start building laboratory quality infrastructure in a country that can support individual laboratories in that country with the implementation of a quality management system using, for example, SLAMTA, but also other tools available.
Of course, one of the good things is that at the moment there is a lot of attention for laboratory sciences. We were always kind of dangling somewhere on the side, but now with the COVID pandemic, people all of a sudden realize how important laboratory testing is. We don't have to explain what laboratories do anymore at anniversary parties, because all of a sudden everybody is talking about RT-PCR like they've done their whole life and all kinds of these things. So this is really momentum which we as a laboratory world, as the laboratory community, need to take advantage of. If we don't do it now, in 2-3 years, it will be gone.
Yeah, but yeah, going to that point, talking about this momentum, it seems like maybe especially in countries down here, we tend to get that sort of momentum whenever there's a big event. Let's say there's a pandemic. So we had that, for example, with Ebola in 2014, 2015, and then this time around with COVID. How do we ensure that we maintain that rather than waiting for these catastrophic events to happen and then rushing to try and meet up with the needs?
I think that is where something like this National Laboratory Quality Framework comes in. If you have your policies in place, if you have your strategic plans in place, if you have your quality framework in place, it's much easier to build a system on top of that. And that's actually also what you saw with COVID, what you saw happening, is that the PCRs which had to be performed were initially done in HIV laboratories and in TB laboratories because they had the infrastructure. And another important thing is that we have to learn from the current crisis. And the World Health Organization has actually now made guidelines for what's called intra-action review and after-action review, which means that you look at, okay, what is going well at the moment, what is not going well, how can we improve that? And after-action review is, okay, how did we handle the crisis? What can we learn from it? And what do we have to have in place for the next crisis? Because otherwise you're constantly trying to reinvent the wheel. And of course, it makes a difference whether you are in Sierra Leone, which has a relatively humble laboratory infrastructure, and where actually half of the laboratory workers that were trained died during the Ebola epidemic. That doesn't help either. Or whether something like that happens in South Africa, where the system is much stronger. But if you don't learn from the current crisis, you'll have to start all over again when the next crisis comes up. So it's a combination of having your infrastructure, having a strong laboratory infrastructure, quality-wise and otherwise organizational, and learning from the current crisis to further improve your system.
Yeah, and to keep the momentum, it's a very difficult question, and it's easier said than done. Of course, the advocacy showcasing the what you achieved with the current momentum, and
Yeah, I think advocacy is something that laboratory workers are not very good at necessarily.
Yeah.
But it's something which is important. I mean, when I give a training, I always say we're very comfortable in doing this, looking through a microscope, but we're very uncomfortable doing this, reaching out to the world. And I think it's important that we also realize that we have to reach out to the world and that we have to showcase how important we are as a laboratory community. And I think that is really, I mean, COVID probably even more than Ebola, because Ebola was such a crisis with bleeding people and people dying on in the streets and things like that. And with COVID, because it's a bit more prolonged also, but you see how important laboratory services are. And we really have to grab the momentum and we have to reach out even when we feel uncomfortable doing that.
Interestingly, I think one of the effects of COVID has also been somehow, I'm not really exactly sure why, but one of the effects has also been to push medical laboratory scientists a bit more out of the lab and into the world and becoming a
Yeah.
lot more vocal. Like I'm seeing it when I look around, I see it a lot more often. I'm seeing more and more people like writing blogs, getting involved and making podcasts, getting involved in actually trying to talk a little bit more about medical laboratory science. So I think with time, I think it's going to get a little bit better and better.
I hope so. That's also what I've been trying to achieve over the last 30 years. So yeah, I definitely hope that will be the case.
Yeah, and it makes it, of course, easier also that now on a global scale, everybody knows the value of laboratories and laboratory scientists much more, and they know more about labs as well. As Linda said, now suddenly somebody at the birthday is starting to talk about RT-PCR, and I mean that's something totally different compared to 3 years ago. Then
you actually see it with the Olympics now, where people start discussing CT values.
Yeah,
nobody had the foggiest idea what a CT value was half a year ago, and all of a sudden it's like, this person can't. Maybe she can join, maybe she cannot join because she has a borderline CT value. Okay. So that's very interesting, but that's really helpful.
Yeah, and you see that the distance between the technical knowledge of the lab scientist and the general knowledge of the public has come closer. The distance has decreased. Yeah. And which makes it, of course, easier to talk and to communicate.
Yeah. All right, Linda, Tjeerd, thanks a lot for spending the time with us today. I'm sure those who watched learned a whole lot. And any last words?
Yeah, well, I mean, we're very happy to work in Africa and with African people. We see that with the African laboratory communities, we see they are very motivated. They work in very difficult circumstances. But I mean, in essence, what I want to say, just keep up the good work, and we'll keep supporting you wherever we can.
Yeah.
Thanks a lot.
I second that.
All right. See you next time.
Yeah. See you next time.
Yeah. Thanks very much.
Thank you, Robertson.
Thank you.